from Louisiana's home team. This is Fox 8 Morning Edition at 6 a.m.
Heart disease is responsible for 41% of the deaths in the U.S. each year, but there are steps you can take to protect yourself. Dr. Meredith Maxwell joins us now with what you need to know. Good morning.
Good morning.
So these stats are pretty high. I mean, what are the factors that lead up to death when you're looking at heart disease? What's happening in your body?
Well, usually it's caused from a break-off of a plaque or a blood clot into the coronary artery, which can actually cause loss of oxygen to the heart muscle, and that can lead to problems with heart beating. So that's pretty much how it works with a heart attack.
And the contributing factors to that, I know part of it is genetic, but what are the other things that we do on a daily basis that can lead to that?
Definitely lifestyle, obesity, being sedentary, eating the wrong things, also diabetes, high blood pressure, cholesterol, which are pretty things that you can kind of control if you see your primary care provider regularly. So that contributes hugely to your risk factors, your age, if you're a man or a woman, those kinds of things can really influence heart disease.
And people may not know the signs. Okay, how do you know your loved one is literally on the verge of having a heart attack? What are some of the signs that you would see?
Well, first of all, you have to know your body and know if something's wrong. So chest pain, shortness of breath, anxiety, any sweating that you might experience, any arm pain. Sometimes it's nausea, sometimes jaw pain, and women can feel things differently. So it's really important to recognize the symptoms. And diabetics actually don't experience heart attacks like normal people do, so the symptoms can vary from person to person.
And I'm looking at some of these symptoms, and people may say at one point or another you have some of these symptoms. So how do you know when it's serious? Is it a matter of intensity of the pain? Well,
really, if anything changes, you should definitely take note of it. Of course, if you have any strong chest pain, you should call 911 immediately and contact, a medical provider. You shouldn't play around with it. And when you go to your primary care, maybe make a plan for what would happen if you, in particular, had chest pain or had some symptoms like this. Because the faster you get to the emergency room, the likelihood of you surviving, of course, goes up.
Yeah, and what do you do? Because I would imagine most people, some people may be calm and others may panic if you're witnessing a loved one experiencing a heart attack. What should you do in that moment after you've called 911? Is there anything else to do?
Well, it depends on the person and the risk factors as to what you should do. So it's really individualized from person to person, aspirin versus no aspirin. So usually you would talk to your provider and say, okay, these are my risk factors. What can I do to make them alleviated so that I don't have a heart attack? And what happens? What should I do if I do have these symptoms?
And considering where we live, the food is so great here, it's hard to turn away from all of these great dishes, especially if you've got, a spouse in your life, another loved one that you're trying to get them to eat healthy. But what are some of the things that really clog up your arteries and lead to heart disease?
So you basically want to do high fruits and vegetables, high fiber. Some of the fatty cold water fishes have been shown to actually decrease risk of heart disease. So, not all diets are for everyone. So, of course, we can tailor that when you come in and get your, your physical every year and tell you exactly what foods would be right for you.
And it's hard just to get people even to stay. I mean, it's hard to stay 100% healthy every day. Is there any one particular thing, though, that you find that speeds up, the contributing factors that lead to heart disease?
Of course, uncontrolled blood pressure, uncontrolled diabetes. If you have really high cholesterol or really high triglycerides, that can do it. But if you're mindful of these and control your risk factors and exercise regularly according to your doctor's instructions, you can really decrease your risk, and that's really important.
Okay, well, some good tips there. I mean, you hopefully, got through to some people. Like, you don't want to be in that situation with a loved one, having to face something that could be potentially deadly or leave you in a situation where you're not fully, able to use every part of your body after an attack.
Right, and recognition is the #1 thing, understanding what the risk factors are and knowing when to, react and call 911.
Okay, thank you so much, Doctor, for coming in.
Of course.
Thanks. Shelley and Jerry?
All right, some great advice there. Thanks so much, Liz.